Hi, welcome to today's session. My name's Aasha Cowey and I'm a Programme Manager at South Central and West CSU and Flex NHS co-founder. And this is Kate.
Hi, morning. My name's Kate Jarman. I'm Director of Corporate Affairs at Milton Keynes University Hospital and fellow co-founder of Flex NHS with Aasha.
Fab. Next slide, please. So this is session 203 of a mini-series developed by the 2021 cohort of the Minerva Now Women's Programme. And as part of our final module, we're presenting back what we collectively see as some of the major shifts that will impact our workforce in the post-COVID world. The views given in these sessions are that of our own and do not necessarily represent that of our employing organisation. And we're also really pleased to be joined by some special guests from our own networks and organisations. So I'm delighted to be joined by Kate today for this session on the challenges. You've already hopefully watched part 1, which explores the session on opportunities for flexible working in the post-pandemic world. This session builds on this by focusing on some of the challenges and ensuring that we continue to be aware of not widening inequalities as a result. Please also do check out the 3rd session, which gives an insight into how others are making it work, including job shares, which I'd love to see more of in the NHS. Next slide, please. So that's just the class of 2021, and we are a group of women working across health and care in the UK who have been doing the Minerva Now Leadership Development course this year. Next slide, please. So on to today's session. So many of the issues around flexible working highlighted by the pandemic are sadly not new, but have been amplified over the last year to 15 months, and therefore awareness has quite rightly been raised. We often hear stories from the Flex NHS community, and Kate will talk a bit more about this shortly. So what we wanted to just do today is reflect on this, showcase some of the statistics out there. Some of them are quite sobering, and think about some of the impact that this might have on our workforce based on the stories that we're hearing. We've broadly focused this session in 3 areas, but they're not all mutually exclusive. The first is about how remote working is not the flexible solution for all. The second is about progression and the gender pay gap. And the third is about presenteeism and always-on culture. We'll present some data on each and then conclude with some overarching recommendations about some tips that you can take back into your workplace to overcome these. This is not an exhaustive list, but aims to stimulate some thinking about some of the things we've heard. Over to you, Kate.
Thank you. So a little bit about Flex NHS, which is a campaigning network that Aasha and I launched in November 2018. And we launched it having met on Twitter and discussed our own experiences around flexibility and return to work, particularly around returning to work after maternity leave. And we've launched this with the idea of sharing stories and creating a network of support and a network that would champion flexible working for staff. We set the network up explicitly to champion staff working flexibly at every level and in every profession and at every grade in the NHS. So that was really important to us, that we would amplify the voices of staff who were seldom heard. To debunk some of the flexible working myths around how people do and don't work flexibly and what that does and doesn't mean, and to help equip organisations and managers with the tools they need to support flexible working well in their organisations. And obviously, since we've launched Flex, the working world has changed very significantly, and flexible working has both come on in leaps and bounds, but also been mixed up, as Aasha has described already, with working from home. And so it's important that we keep this focus on what flexibility truly means in the workplace and how we work and offer a hybrid working solution to suit different staff, different needs at different times in their careers. So one of the most powerful things that we have found with Flex NHS is the personal stories that people have shared and the power of the personal. And in leadership, we often talk about using, your personal experience as a leadership tool to, create empathy and shared experience. And Flex has been really the stories that we've asked staff to share with us have been very personal and very important and very powerful in creating a case for change and a movement for change around flexibility. I won't read them all out, but there are examples here around people working back-to-back shifts and looking after their children at the time that they're not at work, and just the toll that that's taking. A car crash in this instance, we hear this a lot from people around the toll that working patterns take, and trying to particularly manage things like childcare costs within a shift pattern. And also around the lack of opportunity, particularly at this early stage when we first launched Flex. Some of these stories came through around, no, if you can't do this shift pattern, you can't have a job, and actually just no adjustment made or consideration made for people's personal circumstances. And we hear these stories still now, actually, today, around the difficulties people have in accessing flexibility at work. And we also hear some really good stuff too. So those organisations and those parts of organisations who've really helped to support their staff, who've really been able to think flexibly, think differently about how they support staff and about how they get the best from people. And we know that we ask a lot from our staff. We ask a lot from them in their time and the time that they give us, and actually lots of organisations have recognised that actually it's time to give that back, and that flexibility is a two-way street. We ask a lot from our people in terms of extra hours often, and to do a little bit more and to go a little bit further and to walk the extra mile, phraseology that we use a lot, but actually we need to give that back, and these stories have demonstrated that that is happening in the NHS, and also that we've got some good positive basis to build on in terms of supporting and rolling out flexibility more broadly across the service. Back to you, Aasha.
Thanks, Kate. So the first challenge issue area to explore is that remote working is not the flexible working solution for all. We've challenged the notion around what flexible working is and isn't a lot over the last few years, and actually for some it's about having a fixed pattern and more predictability and routine to support other things you've got in your personal life. CIPD recently examined the Labour workforce survey, and I think it was nearly 75,000 individuals they had the data of in October to December 2020, and they used this data to have a look at what impact COVID was having on flexible working arrangements. And one of the most worrying trends that's come out of that and that we've become aware of is the reduction of uptake of flexible working options such as part-time and job shares. So we often refer to the TimeWise model. They refer to 3 pillars of where, when and how much. And what remote working has done is we have focused a lot on where people are working and when, but not really the how much. And it's really, remote working doesn't offer alone that same opportunity when it comes to how much individuals are working. And it's really important we don't forget this, and people who need those arrangements aren't left behind. We've also got a statistic from the Royal Society of Public Health. 44% of women are more likely to develop musculoskeletal problems as part of working from home. And also the same survey reported that just over 1 in 4 individuals are working from home on a sofa or in a bedroom. We've also sadly seen a big rise over the last year in calls to the National Domestic Abuse Helpline. 72% of the individuals supported were women, and there's various stats about that over the last year, looking at different time periods. Next slide, please. So it's really important to think about it. It isn't the solution for everything. It isn't the solution for all. And some of the impact that this might have is, first of all, the office v working from home conversation is seen as binary, and actually it has to contextualise other aspects. For most people, it's more likely to be some sort of hybrid solution, but we can't forget about the how much people are working as well as the when and the where. As just mentioned, there is that danger that some staff might be in danger at home due to domestic abuse. And also there's other risks to mental health where individuals may have lost their social networks alongside the physical problems we've just referred to. And the last thing for us again is there increased difficulty in finding part-time opportunities or getting other flexible working requests signed off? It's critical that we don't make that worse, and we don't risk making things harder for a proportion of our workforce who do need part-time and other alternative ways of working. Next slide, please. And also, sorry, I forgot to say, just to be clear, we're not saying remote working is a bad thing on its own. It's just about contextualising it and making sure that we are looking at the bigger picture. So these are some pretty sobering statistics. 1 in 4 women were considering downshifting their careers or leaving the workforce entirely because of the impact of COVID. And we know that NHS is 78% women. So we really need to think about that. And also, over 2/3 of additional responsibilities from COVID, such as homeschooling, were absorbed by women. But Pregnant and Screwed also did a pretty big survey. I think it was just short of 20,000 people, and they found that 15% of mothers have either been made redundant or expect to be made redundant, and of those, 46% said that a lack of childcare provision played a role in this. And then just to end on, something really critical, the gender pay gap reporting stopped in 2020. So for those that aren't aware of it, in 2015, I think Grazia launched the Mind the Pay Gap campaign, and this encouraged companies of who employ more than 250 people to publish anonymised details of their pay in order to encourage employees to address those pay gaps. In 2020, this was stopped due to the pandemic, although recently Grazia have campaigned again alongside the TUC and Mother Pucker, aka Anna Whitehouse, to ensure that the gender pay gap reporting would take place in 2021. It is going ahead, but it's been delayed by 6 months. But we have to be mindful that we might not be seeing some of the impact of what COVID has done through that lack of reporting, where organisations are not taking a more proactive approach to having a look at the impact on their workforce. Next slide, please. So some of the impact of that is on this slide. So I've already mentioned, the NHS has a high proportion of women, 78%. So if that gender pay gap risks increasing, and we've got more women exiting the workforce, that could have a really big implication on us. Secondly, decision making could be occurring then by groups who are not diverse, leading to more groupthink and lack of challenge. We also know that the impact of the pandemic has been disproportionate on minority ethnic groups. So again, we might be, creating less diverse areas to have some of those challenging conversations. Something that was recently brought to our attention on Twitter and was a bit of an eye-opener for me was actually whether working from home means that we might be less likely to support individuals who need reasonable adjustments in the office. So we have to be really careful that we don't see working from home as being the default for those individuals. We have heard that working from home has been a really good leveller for some of these people. They've been able to participate and engage in ways that they hadn't before. But again, they shouldn't have their choice taken away from them if organisations are then not prepared to make those adjustments going forwards. And then the final thing is we risk creating that two-tier system, and have we got a lack of visibility of those working from home being overlooked for promotions? So these are really important things to keep in mind. Next slide, please. I think over to you, Kate.
Thank you. So we talked a bit about this presenteeism and the always-on culture, and I think that there's perhaps a conception or a misconception that working from home is by default more flexible and creates more ability to switch off and to balance work and life more effectively. But actually, what I think we found, the evidence has borne out over the pandemic period, is that many people are finding that much more difficult, and that actually work intruding on your home life and the sense that you're living at work rather than working from home is real and quite damaging. So some statistics here around 56% finding it harder to switch off, that there is an increased sense of isolation, and that actually that is more heavily felt by women than men in the study that the Royal Society of Public Health undertook. That it puts a strain on relationships within the household, and that a really high proportion of employees working exclusively from home are experiencing symptoms of burnout. I think that's really troubling. It's troubling from a welfare perspective and from a support perspective, and as an employer, we really need to think about the offer that we make to staff working at home to help support them in managing their work and life and work-life balance and blend effectively. because it's really easy not to do that if you can't see your employers and your employees rather, and you can't see the impact of work on them at home. So these are really important conversations, really important to recognise and reflect on how we reduce the likelihood of people burning out and working continually. And just as that we've created over decades that sense of being present in an office or being present on a site, and being here early and being here late as important and as an important indicator of how effective you are as an employee, then that's simply transferring that to a home environment where actually being always available and always accessible means that you're being effective and productive. I think again it's a myth we really need to tackle hard, because it's a dangerous myth, and it really is a myth, because actually people can be very unproductive working long hours. And I think it goes back to Aasha's point around it's not the where and the when, but it's also the how much, and that's a really important part of that sort of tripartite way of looking at flexibility at work. Again, looking at the impact, I mean, burnout, exhaustion, and continuing to work when unwell, so all those unhappy habits that we have with cultures that have a strong presenteeism element to them, happening at home as well, but also happening in tandem with isolation and other factors. So other factors around quality of housing, social support and structures at home. So all of that can compound that burnout and exhaustion and that difficult working environment. So working more hours and contractually paid. And I think that's probably a particular problem for part-time workers. And actually, when you're blending work and life, particularly during peaks of the pandemic, when people were trying to juggle homeschooling and other commitments as well, that meant that people were working strange and unusual hours. To going back to that kind of earlier conversation around back-to-back shifts and childcare, and cramming all of that in at home is just as undoable as it is trying to do it all and come onto site. So unreasonable expectations around meetings and personal boundaries, and I think lots of people have probably found the idea of a sort of Teams screen or Zoom screen or Skype beaming into their bedroom or living room or kitchen quite invasive and intrusive, and actually it's quite difficult to say no to, because there's that expectation that you're available because you're at home. And I think again it's about resetting expectations and helping to support people with those boundaries and those time boundaries. There's lots of discussion I know around a sort of legal requirement to turn off and to give employees that ability. But I think we also need to think about our moral duties as employers around setting those boundaries and helping to reinforce those. And that sort of lack of time to think and that headspace, all those things that actually you want to create in people's working days to enable them to catch up, to do admin, to do all of those things, to create space for good conversations and creativity, and to be able to do that at home is challenging and hard. And actually, again, if we've got a culture where it's back-to-back meetings all the time, then all of that time disappears, and that has a really unhelpful impact on people individually, but also collectively in terms of productivity and particularly creativity. So what can we do about it? I think there's, again, it's raising awareness, it's talking about these issues, it's really bringing them to the fore. And I think, in the NHS often, as probably with many industries, we move on very quickly, and we go from, working in a pandemic to post-pandemic recovery, and things change and we move on. But we really need time to reflect and to learn and to appreciate what people have gone through over the last 15 months and what's worked and what really hasn't worked. And we then need to build those into the plans that we have for flexible futures, and flex in the future is going to be really important, but it's important that we get it right. So raising issues, exploring hybrid working, challenging that notion of flexible working, and debunking that kind of new myth that remote working, home working is flexible by default, and it's not, and we need to be really clear about that. Having open dialogue, discussion, collaboration around working patterns, looking at inclusion in recruitment practices, so not just in flexibility, but as Aasha described, around recognising those people with disabilities or reasonable adjustment, how that is going to be incorporated into home working or hybrid working in a way that it would be in an office environment. And looking at underrepresented groups and your decision-making processes, and how we are more inclusive, more collaborative, and look beyond the sort of boundaries that we perhaps have around those processes to recruit and retain staff. And need to do that, sorry, and look at choice and autonomy, agency, all those things that are important in flexible working conversations and always have been, around giving people choice, giving them opportunity, giving them opportunities to join in different ways, and how we support that in a very hybrid way of working. So when we're working digitally, when we're working face to face, how we can continue to support staff and give them opportunity and agency in both those environments. Using gender pay gap, res data, WDES data, all of the data that we collect on inequalities and inequalities affecting our workforce, and doing something about them, and matching up these conversations around flexibility and opportunity with those inequalities, and how we can use flexibility and different ways of working to support closing those gaps. And role modelling, really important, having those conversations around boundaries and not being afraid to share personal stories and to have them yourself, to help staff set boundaries and be realistic. Aasha, I think, for the closing slides.
Thank you, Kate. So we like to always end with a slide like this, just to sort of help you remember your own value. So, you are not only, you are not just, you are not less than, you are not only part-time, you are not just admin, you are not less than full-time, you're one of us, you are what makes the NHS work, and we don't care how or when or where you work, we care that you do what you do. You are everything that you need to be, and we will make work together. I do like reading that one out because it's a nice way to end it, and we know generally the audience we get for these sorts of things are other people that might be struggling with some of these, so do remember your value. And then I think the last slide is just to highlight thank you for joining us, for watching this session. Kate, thank you for coming along and being part of this session with me today, and just to check out the YouTube channel for the other 2 videos. We will also be doing our Twitter chat on Flexible Working Day on the 2nd of June between 6 and 7. Thank you.